We get Esther ready for a brief interview before she can go rest. She's just given birth to twins at the Kenyatta National Hospital. Her babies are part of 1.5 million babies born annually in Kenya. 193,000 of them are preterm babies, born before 37 weeks. Over 13,000 will die due to complications. Breast milk is said to be one way of reducing these preventable deaths.
When a mother delivers a baby, the most important thing for that baby who has been delivered is the breast milk.
Esther doesn't have enough breast milk for her two babies.
Nafeel vibaya kwa sababu ya hao mama wengine pia walikuwa na express maziwa mingi, mimi kwangu nafeel nilikuwa azimika chini sana. Na nafeel vibaya pia kuongeza hiyo unga sababu kupenda kwangu.
What the WHO recommends is that the mother's own milk is the first option for a baby, and if the mother is not there to breastfeed their child or to express milk for their children, the second option should be donated human milk.
Dr. Elizabeth is a research scientist working with several stakeholders, including the Ministry of Health, in establishing the first human milk bank in the country.
A human milk bank is actually a place where women can come and donate breast milk, and that breast milk is processed so that you can remove all the microorganisms, so it's made safe for the child, and then that milk is stored and then distributed to children.
A human milk bank essentially is to help babies who can't access their mother's milk at birth.
Babies who, for various reasons, some of them moms become sick soon after delivery, mentally unstable. Sometimes they are forced to be treated using certain drugs that may not be very good for the baby. In other cases, moms die during birth.
Kenya will follow in the footsteps of South Africa, the only country in Africa with a milk bank. In the West, however, it's a norm, with online sites that link needy babies to institutions, homes and donor mothers, the initiative saving millions of lives.
And I've seen it with my own eyes now with 3 different babies. And breast milk is the only thing they could tolerate. And
Hanika, a Canadian, understands this. She has been a donor several times. A mother of 2, she says she knows the value of what is now termed as the white gold. At one point, wet nursing a critically ill baby who was at the ICU. Wet nursing is feeding the baby directly.
It's a strange feeling having this baby who's not so, not so beautiful and, on your breast. It's not your child. But, within 1-2 sessions, she latched on really quickly.
At the Kenyatta National Hospital, the nutritionist wait in earnest for the milk bank. The largest referral hospital has a golden standard for breast milk.
Some may not be able to produce adequate milk. So such frustration that the mothers goes through. If at all there will be the idea of having this milk bank, this issue may be able to be solved.
The only challenge is what is in the public domain, that supposing this milk is not so safe in terms of such conditions that would be passed on through breast milk, like HIV virus or even hepatitis B. But as long as it is explained to them carefully and properly that such status would be established before anything like that happens.
A lot is taken into consideration before establishing a human milk bank. But even when all health standards are taken into consideration, cultural beliefs remain a stumbling block.
In other countries, like in Nigeria, if you give a child, another mother's child, your breast milk, that child becomes it's like a sibling to your children.
Notwithstanding, the milk bank researchers say the human milk bank is a cost saver, fighting off sickness that would be costly to treat or buying expensive formula milk. The WHO recommends exclusive 6 months breastfeeding unless on doctor's advice to supplement with formula.
The breast milk compared to animal milk and infant formula supersede the rest.
Kandie, Citizen TV.